Every breath depends on coordinated movement of the thoracic wall. We have seen in the previous discussion the movement of the thoracic wall, the pump handle and the bucket handle movement. But how do these muscles contribute to this respiratory movement? Let's figure out together. What's up, ladies and gentlemen? Welcome back to NeuroSketch with Dr. Kenny. But if this is the first time you're seeing this channel, don't forget to subscribe. Today we are talking about the muscles of the anterior thoracic wall and how these muscles contribute to the respiratory movement. Alright folks, time to dive deep. Before we go directly to the muscles of the anterior thoracic wall, let's first have a look on the muscles of the thorax. We have said there are a lot of muscles that are attaching to the thorax, not to mention the anterior axoappendicular muscles, for example, the pectoralis major muscle, the pectoralis minor, the subclavius muscle, the serratus anterior. But we've seen posterior the muscles that attach to the thorax, for example, the posterior axoappendicular muscles, the serratus posterior, superior, serratus posterior, inferior, and some other muscles, a lot of muscles in fact. But these muscles, they attach to the thorax, but we have the muscles that are originating to the thorax and they are dealing with the respiratory movement, and these muscles, they make the thoracic wall. We have the intrinsic, these muscles could be considered the muscles of the thorax proper, the true muscles of the thorax, because their primary purpose is to move the thoracic wall, is to move the thoracic wall and to protect the structures of the thoracic wall. These other muscles, their primary function, for example, the pectoralis major, the primary function was to move the upper limb. So these other muscles were not really meant for the movement of the thoracic wall, even though they have effect on the thoracic wall, as we have seen that any muscle that is attaching to the thoracic wall, it has potential of moving the thoracic wall. It has potential of changing the volume of the thoracic cavity, which results into movement, into respiratory movement, whether inspiration or expiration. But the purpose of this discussion today is to discuss the muscles that are moving, that's primarily involved in moving the thoracic wall, changing the volume of the diameter, changing the volume of the thoracic cage, which will result into respiratory movement. We have as I've said, these muscles are specifically they change the diameter of the thoracic wall or the volume of the thoracic cage, which results into the movement of the thoracic cage. The muscles of the thoracic wall can be put in five groups. And these groups we have the muscles which are considered as the intercostal muscles. So we have three groups of intercostal muscles that are arranged in rear from superficial to deep, and then we have the subcostalis muscle, the subcostal muscles or subcostalis muscles, and then we also have the transversus thoracis muscle. We're going to discuss each muscle in turn. Why are these muscles three? Why do we have three intercostal muscles? These muscles are arranged in layers from superficial to deep. So we have the muscles which are outside, and then we are going to deep. So you can see we have the external intercostal muscles, the internal intercostal muscles, and the innermost intercostal muscles. They're arranged in three groups. But why 11 pairs is because we have these muscles are called intercostal. The word inter means between, costal means ribs. These muscles are found between ribs. So why do we have 11 pairs? Because we have 11 intercostal spaces. These muscles are found in the intercostal spaces. We have 11 intercostal spaces, and this is because we have 12 ribs basically. Because if you have, for example, you have 3 ribs of 3 fingers, the spaces between these 3 fingers are actually 2. We have 2 interspace. And if we have 12 now, if we have 12 pairs, we have 12 ribs. The spaces between ribs will be 11. This is why we have 11 pairs of these muscles, and these muscles are found on either side. You have the right side and the left side. We have 11 pairs on either side. We are starting with our discussion with the external intercostal muscles, and the external intercostal, because they are found the most superficial group. External intercostal, they are running all the way from They are running all the way from the tubercle of the rib as far as anteriorly to the junction between the ribs and the intercostal cartilage. It is coming all the way posteriorly from the neck, from the tubercle of the rib, and into the junction between the rib and its corresponding costal cartilage here at the junction between the rib, costochondral junction, costochondral junction. And the anterior, so it is running from the tubercle of the rib all the way to the junction between the rib and the corresponding costal cartilages. And then what happens here is that it is being replaced by the membrane. So from the junction between the rib and corresponding costal cartilage, this muscle is replaced by a thin layer of membrane, and this membrane is called the external intercostal membrane. External intercostal membrane replaces the external intercostal muscles anteriorly, and because this membrane is found anteriorly, it can also be referred as anterior intercostal membrane. Anterior intercostal membrane. What are the four major things about muscles? Origin, insertion, innervation, and action, right? But the innervation of all the intercostal muscles, is easy because they are all supplied by intercostal nerves. But what's the origin? This muscle is coming from, this is rib and this is rib. This muscle, this is the external intercostal. It is originating. It's coming from the lower border of the rib above. It inserts the upper border of the rib below. So it comes from the rib above to rib below. It connects in that order. Yeah, but you can see the orientation, the fiber direction of this muscle. The fiber direction is coming from posterior to posterior to anterior but inferior. So it's moving in anterior inferior anterior direction, and this is just like how you're putting your hands in pocket. So this movement is called this direction of the intercostal external intercostal muscle. It is called the hand in pocket movement, which is also called inferior anterior, because coming to anterior, but some books will also refer to the inferior medial direction. That's the direction of the internal intercostal muscles, of the external intercostal muscles. Innervation, as I've told you, it's been innervated by these muscles have been innervated by the intercostal nerves. But what about the action? So think of that origin insertion stuff. Like if you are the muscle contract, it will pull the insertion towards the origin. And so if that's so, this muscle will pull this rib towards the rib above, and it will result into elevation of the rib cage, and mainly result into respiration, but mainly by the bucket handle movement. Remember, the bucket handle is operating on the lateral surfaces of the rib, like on the lateral parts of the ribs. And then we have just next to it, as we're going deep, we have the internal intercostal. Outermost is the external intercostal, the most superficial, but deep to external intercostal, we have the internal intercostal, and the internal intercostal is running in perpendicular direction to the external intercostal in such a way that they are forming a 90-degree intersection. This one is running in this direction, and this one is running in the other direction. So they are forming the intersection. That's the internal intercostal muscle. The internal intercostal now, it is running in the posterior. It's running in the posterior inferior direction, right? Posterior inferior direction. And the internal intercostal also, it is originating, is spanning anteriorly from the lateral border of the sternum anteriorly as far as the angle of rib posterior. So it comes all the way from the lateral surfaces, lateral borders of the sternum, and then it goes all the way to the angle of the rib, the costal angle. And so when it reaches the angle of the rib, this muscle is also being replaced by a thin layer of membrane. This thin layer of membrane is called the internal, because it's of internal intercostal. It's called internal intercostal membrane. But because this membrane is posterior and we had the anterior one, This one should be posterior. It should be called also posterior intercostal membrane. So these words, the internal intercostal membrane or posterior intercostal membrane, are used. They are used synonymously. They refer to the same thing. And you will see anteriorly and inferiorly, the internal intercostal blends. So it is like it joins the external abdominis or external oblique abdominis. We're going to discuss the external oblique abdominis when you're doing the anatomy of the abdomen, but at least now you know that it blends. The internal intercostal blends with the external oblique abdominis. External oblique abdominis. Again, the internal intercostal muscle has got two parts. It has got two parts. We have said we expect it to span all the way from the lateral border of the sternum into the angle of the rib, and then it is later replaced by a thin layer of membrane, and that thin layer of membrane is called the internal intercostal membrane or posterior intercostal membrane. But it has got two parts. It has got the interosseous part, which is called the internal interosseous intercostal muscle. And then internal interosseous, because this muscle, it is part of the muscle, is between interosseous, between bones. Inter means between, osseous means bone. Now, what are these bones? These are the ribs. And then to differentiate it from the internal interchondral intercostal muscles. This internal interchondral is between the costal cartilages. This is between the costal cartilage, but this internal interosseous is between the muscles. So we have two parts of the internal intercostal muscles, the interosseous part and the interchondral part, and they have different fiber direction, and they have maybe the fiber direction is the same, but they have different actions. This is why it is important to pay much attention here. But innervation is the same as we've seen the intercostal nerves. So what are the origin, insertion, and action? The origin, the internal intercostal nerve, the internal intercostal muscle, the interosseous part now, it originates from the inferior border of the rib above. It inserts on the superior border of the rib below. Almost same as the external intercostal, but the difference is in orientation of the fibers. Like they are making 90 degrees. They are in an intersection. They intersect at 90 degrees, forming the perpendicular direction. So they are almost same as the intercostal, but the difference is the fiber direction. But the internal interosseous intercostal muscle does not follow that rule of pulling insertion toward the origin, because when the internal intercostal contracts, the net effect is pulling the rib towards downward. So it pulls the origin toward the insertion now. See, this is why it disobeys that rule, and so the action of internal interosseous intercostal muscle will be to depress the rib. And remember, if you are depressing the rib, you are decreasing the volume of the thoracic wall. And what happens when the volume of the thoracic wall goes down? That is expiration. But which kind of expiration? We discussed in the previous discussion. If you haven't watched it now, this is your time to go back. We said expiration is mainly a passive process. It means it does not use energy. But we said it sometimes it is active by some other muscles, and this is the muscle that is resulting into a forceful or active expiration. Expiration is mainly a passive process, but it can also be active because of contraction of certain muscles. What are these muscles? This is the internal interosseous muscle, and we're going to see also some other muscles soon. But internal interosseous muscle resulting into forceful expiration. And what about the external? Now the interchondral, we have said they have different functions, and this function they opposite to one another, because this one was doing the forceful expiration, and the internal interchondral now will result into elevation. Almost now, see, the direction is almost the same. The direction of pulling, the direction of fiber direction is almost the same, because this is originating from the costal cartilage of the rib above and insert on the costal cartilage of the rib below. But the difference is this muscle, when it contracts, it pulls the insertion toward the origin, right? So if it does so, it elevates this rib cage, and gives that the pump handle movement, and so it helps in inspiration. That's easy. And we've seen that we have two intercostal, internal intercostal, which have different fiber, different actions. So in summary, so this is innermost intercostal. Innermost intercostal is deep to internal intercostal. We have seen external intercostal, internal intercostal, and the innermost. Innermost intercostal. The innermost intercostal is found, inner, the most innermost one. This is why it's called innermost. But it has fiber direction almost the same as the internal intercostal. But the only thing that we differentiate, the only thing that will make you be able to separate the internal intercostal from the innermost intercostal is that there are these neurovascular structures. The nerves and vessels are passing between the internal intercostal and the innermost intercostal. Between the internal intercostal and the innermost intercostal, we have the neurovascular structures that are passing, and that's how you really locate. We're going to discuss then. We'll have a separate discussion on the existing intercostal intercostal vessels and nerves, but you know that they are passing between the innermost intercostal and the internal intercostal. The innermost intercostal, they are discontinuous, like they are found in patches. They're not well developed, but they are well developed on the lateral parts. They are well developed on the lateral parts. Same rule: origin, insertion, innervation, and action. They are originating on the superior, they are originating on the rib above, the rib below. Almost now, these all muscles, they have the same, origin and insertion. They are originating from the rib above and the rib below. They are inserting the rib below, just above. They are originating just above the costal groove, and they are inserting the superior, but on the medial side, on the medial-most side. And its action is almost the same as the interosseous intercostal. Interosseous intercostal, in such it depresses the rib cage, but this action is also debatable. Right? The scientists, science is changing, and they are still considering. They are not sure if this muscle is resulting is helping in respiration. They are not really sure about it. But I would say all the intercostal muscles are being supplied by the intercostal nerves. So in summary, we have seen external intercostal, internal intercostal, and the innermost intercostal. The external intercostal results into inspiration by the bucket handle movement. The internal intercostal has got two parts. It has got the interosseous part and the interchondral part. The interosseous part will result into forceful expiration because they draw the rib cage downward. They result into forceful expiration. But the interchondral part, they result into elevation of the rib, just like the pump handle. So it results into pump handle movement. That's the interchondral part. But the innermost intercostal, it helps the internal interosseous by depressing the rib cage, resulting into increased interthoracic pressure and resulting into expiration, forceful expiration. All right, now we have said we had 5 muscles of the thoracic wall. We have seen 3 of them. Now we are discussing the other 2. What are the other 2? We have the transversus thoracis, and this is the transversus thoracis, as you can see. But because this muscle is coming from the sternum to the ribs, it is called the sternocostalis muscle. Sternocostalis because it comes from the ribs, from the sternum to the ribs. But because it's also triangular, it can also be called a triangular sterni. Triangularis because it's triangular. What's the origin? Obvious, you can see it originates from the posterior surface of the lower sternum, and it goes to insert to the costal cartilage. So this is the origin. It goes to insert to the costal cartilages of the rib number 2, 3, 4, 5, 6, or 3, 4, 5, 6. That's the insertion. But always the costal cartilage. It inserts the costal cartilage, not the ribs. And then what are the action? Because it comes from here, it inserts here. When it contracts, it pulls the ribs towards the sternum, and so it results into depression or elevation. Yes, depression because it draws, but it's actually a weak depression because it's just a weak depression. Is that into depression? And what about innervation? Also, we've said the innervation is by the intercostal nerves, but 2, 3, 4, to 6 or 3 to 6, depends on the origin of this insertion of these muscles. And last, we have the last of the muscle of the 5 muscles, who have the subcostalis muscle. The subcostalis muscle is well developed. It's not found, because even though today we are talking about the anterior thoracic wall, this the subcostalis is found on the posterior thoracic wall. Posterior thoracic wall, is worthy to mention it now here. Okay, so it well develops on the lower surface, on the lower part of the thorax, and it originates from the rib above and set the almost 2-3 ribs below. 2-3 ribs below. They all help into depression of the rib cage, resulting to forceful expiration, because these are found downset when contract, they result into depression. And they usually cross one or more intercostal spaces, one or more interspace. Last, we have now these muscles, other muscles of thoracic wall. Other muscles, we have seen we have 5 main muscles that make the thoracic wall, but we also have some other muscles that are forming a part of the thoracic wall, and they're usually overlooked. We have the serratus posterior superior and the serratus posterior inferior. We discussed this, maybe we discussed this when we're doing the muscles of the back. But these muscles, for example, the serratus posterior superior, they will result into elevation of the first 4 ribs, and because they are doing elevation of the first 4 ribs, they are helping in inspiration, right? But then the inferior serratus posterior inferior, they will, when they contract, they will depress the lower ribs, the lower 4 ribs, and because they are doing the depression of the ribs, they are resulting into decreasing the thoracic pressure in the thoracic volume, resulting into expiration. So the serratus posterior superior will result into inspiration. The serratus posterior inferior will result into expiration. Perfect. Expiration. Perfect. And then we also have the Levatore costrum. Levatore costrum. This Levatore means something that is lifting. So these muscles elevate. They elevate the rib cage, and because they're elevating the rib cage, they're resulting into inspiration. Inspiration. So guys, in summary, we have seen the muscles of the thoracic wall. We've seen external intercostal, internal intercostal, and the innermost intercostal, and then we have seen some other muscles like transversus thoracis, which is actually weak depressor, and the subcostalis, which also result into weak depression. All these muscles, they make the thoracic wall, but they're helping in respiration. The main muscles of inspiration we have said, and even the previous discussion, and today we also discussed the main muscles of inspiration, but we haven't discussed the diaphragm. The diaphragm, the discussion next time. All right, guys, this is what I had for you today, and as always, if you have a question, additional comment, you can always put your thoughts in the comment section. But you have Instagram and TikTok account, make sure you swing there. We usually post useful information there, useful concepts, and don't forget to subscribe if you haven't. Share this video and like this video, and share with your friends to spread the knowledge. All right, see you next time.